You can do it. Come on, come on. All right, and one last one. Give all you got. Come on, come on, come on, come on. And that's perfect. Well done. You can put your shirt back on. Well done. The motor control of your shoulder muscles is really getting better. We'll continue with a new exercise that is similar to what you have to do at the factory.
Is it possible to take a little break?
Are you okay?
Look, no. I don't know. I'm still having a hard time with each movement. And I'm also worried about going back to work full time.
I understand. It's a big step, an important step for you.
Well, you can say that.
There you go.
Thanks.
You can sit down for a bit. Work-related injuries aren't simple. There are so many factors to take into consideration and so many people involved. The patient, his employer, his doctor, his family, the workers' compensation board. It makes things complicated, and I don't have enough time at the moment to do everything with him. Are you ready?
Okay.
Come on. Listen, Stéphane. It should be fine. You'll follow the advice we talked about together to avoid overusing your shoulder, and by respecting your limits, you'll gradually get back into your rhythm and become more comfortable in what you do. You need to trust yourself.
Okay.
Okay, so this exercise here, I hope it's going to work. Otherwise, he's going to get even more discouraged. He's quite nervous. I'm not sure he's ready. But we have no choice. Things are not progressing quickly enough. The block of care is ending, so he has to get back to full-time work. If only we could continue a few more sessions after he started full-time work again. That would improve the chances that his return goes well.
Listen, if I do a whole day's work, how will I be able to take care of my kids at night? How will I be able to remove the snow from my car every morning or in the evening when I leave the factory? A full day is going to use all my energy. I'm going to be hurting all day, won't be able to do anything else, won't be able to sleep well. My shoulder needs to be much tougher to be able to do all that. I don't feel ready.
That's a good point. I understand. I can't see how he'll be able to look after his young children after a full day at work. Don't you have anyone around you who could help you with your children during the first weeks? When you go back to work full time?
Well, my wife's been missing lots of work because since my injury. My mother's ill. I really don't see who I could ask.
I'll see what I can do. See if we can find any solution that makes it easier for you. Let me think about it.
Okay.
I'm sorry, Stéphane. Our session's already finished. I have to eat quickly because I have another patient after. I won't forget you, okay? We'll see each other tomorrow?
Yes.
Bye. If I could only get 2 or 3 extra weeks doing physio and gradual return before a full-time return to work, but I've already negotiated to extend the treatment period for other patients. I'm not sure I can discuss it again for Stéphane. Are you okay?
Yeah, I'm just trying to do these reports for the workers' compensation board. I don't know if it's going to be useful to anyone there, but it has to be done, hey? Besides, it's so unclear what they need and what has to be written in them.
Yeah.
And you? You okay?
Well, don't you find it unfair that everything's different for our patients who had accidents at work and all our other patients? That we only give them 20-minute treatments instead of the double? That they're more often seen by a kin than a physio, and that they have to come less often per week? I know that the clinic wants us to make them come less often so that we can keep within our budget, because we only receive fixed block payments for injured workers. But it's the same shoulder problem that my other patient who injured himself playing badminton. And I can see him as much as I want for a full session.
Yes, but it's like that in several clinics, you know.
You know, when I became a physiotherapist, my goal was to help injured people get better. The place where they got injured, whether at work or somewhere else, it shouldn't make a difference. After all, beyond the clinic's reimbursement rates, they are the patients, and they should all be considered equal.
Yes, and at the same time, if there is a group of patients who need more support and the best physio care possible, it should be injured workers, because their problems are so complex sometimes. But you know how it is. It's been like that for some time now. We don't really have the power to change that.
Well, I'm not sure about this. What if all the physios started talking about this with the decision makers to find solutions?
I'm sorry, I've got to try contacting the case manager to talk about my patient. He and I really don't have the same schedules, and I just had time to call him yesterday after my last patient, but it was too late.
Hey. Don't forget to hand in your patient evaluation reports. We've got a deadline to meet if we want to get paid. Got to keep them happy.
Robert,
Yeah.
can I meet with you later this week?
Sure. I've got an opening Thursday morning. Does that work for you?
Sure, yeah, I'll be there. Thank you.
Something on your mind?
Why do I feel that there are two types of patients in our home?
I know what you mean. It's nothing in you. But you know that the system puts demands on us for compensated workers.
Why? It seems unfair to me. A patient is a patient.
Well, I imagine you must have some concrete suggestions for me?
I'm not sure. Concerning the time organization, there would be things to change. It would be nice to have the same amount of time for every patient. 30 to 45 minutes, no differences.
You have to seek, free up time. No doubt we'd have to stay within our budget, and as you know, those patients aren't the ones that bring in the most.
Yes, but it seems unfair. I'm not comfortable with it.
I can't contradict you on that, but I'm not the one who sets the workman's comp rates.
Yes, but we're professionals. We have duties. We have choices to make.
Well, I understand your point, so
With the physio schedules, there are also things to change. It would be nice to have a period block to get paid every day for us to finish our administrative work. The forms take a lot of time to fill, even more when the patient hurt himself at work with all the paperwork that's added.
I understand your points.
And if we had a bit of time like that, we could reach to the case managers at the Workers' Compensation Board on opening hours. At the end of the day, we'll be more efficient and the patients will benefit too. It's tiring for us physios, Robert. We put a lot on our shoulders.
You know, and it's true. There are a lot of things we need to improve with respect to injured workers' treatments. You know, and for sure, Workman's Comp has got to modify their reimbursement practices and get their house in order. But I also know that as an owner of a clinic, that I have a responsibility in there as well. And, you know, everyone has to do their part.
I know that these are not super complicated things, but it would really help the situation.
We can do our part starting now. What do you think if we were to hold a meeting of the entire team to discuss it? You know, I could free up a lunch hour for everyone and do it.
Yeah, that would be great. Yeah.
But, you know, we'd have to enter into some very serious discussions as well with the important players. I mean, there's our professional order, there's the Workmen's Compensation Board, professional associations, other owners of clinics, and the clinicians and the patients. I mean, it's complex, but it's doable.
I know that some groups already speak with each other, but there are so many issues to discuss. It would be really great if we could talk about it more.